I've gathered my supplies, I've washed my hands, I've checked the chart for diagnosis. Knock, knock, knock.
Come in.
Hello, Mr. Beckham. I'm Keely. I'm a student physical therapist assistant. Can you tell me your first and last name?
Beckham Tiemann.
Alright, and your date of birth?
August 21st, 2002.
Let me see your wristband. Alright, that makes sense. Alright, Mr. Tiemann, what we're going to be doing today is I'm going to be doing some spine range of motion. I'm in here because of your recent motor vehicle accident. You've been laying in bed for a while, and we want to just see how far and like how stiff you are in your back and neck. Nothing too crazy. What you can do for me is just I'm going to be giving you cues throughout this process. Just kind of like bend your neck, look to the side, nothing crazy. Have you seen any other therapies today? Ooh. Do you have any open wounds that I should be aware about?
No.
Do you get nauseous when you move around?
No.
Do you have any rashes?
Mm-mm.
Alright. Well, do I have your permission to go ahead and get started?
Yes, ma'am.
Alright. So you can go ahead and stay seated for this first part. First one we're going to do is flexion. So go ahead and sit up for me. Alright. So let me make sure you can get to 90. Good. So I'm going to palpate here. Go ahead and look down for me. Stop. Good job. Get to 90. Alright, relax. I got 16 degrees. Alright, next we're going to do the same thing, just kind of look backwards for me. Alright, stop. Open. Alright, relax. Alright, a lot more motion there. Got about 40. Got about 40 degrees. Good job. Okay, the next thing we're going to do is lateral flexion. Come back here, I'm going to palpate C7. I'm going to put my fulcrum on it and put the proximal arm down the spinous process and have the other arm right in the middle of your head. So what I'm going to ask you to do is touch your ear to your shoulder. Palpate. Stop. Don't lift your shoulder. Just relax. Do it again. Good. Try to go a little slower. Stop. Alright, relax. I got 35 degrees. Alright, next thing we're going to do, let me get on this. This thing has fallen on me before. Okay, go ahead and sit up for me. So now we're going to do rotation. Going to get to the middle of your head. Oh my god. Almost fell. Alright, go ahead and look back a little more. There you go. Alright, you're at 90. Go ahead and look to your right side of your head. Go and do it again. Do it a little slower. Make sure. Alright, stop. Alright, got about 50 degrees. Good job. Alright, the next thing we're going to do, we're going to be standing up for this part. So go ahead and stand up for me. Alright, face that way. Thank you. Alright, I'm going to be making marks on you. Is that okay?
Mm-hmm.
Alright, I'm going to make a mark at C7, which is right there. And is it okay if I pull down your pants just a little bit?
Yeah, that's fine.
Alright, so I'm going to palpate for S2. So iliac spines. Alright, gonna make a mark. Alright, you comfortable? Are you nauseous or anything?
No, I'm fine.
Alright, I'm gonna measure. Alright, I got about 47. Gonna go document that. Alright, now what I'm gonna ask you to do is you're going to roll forward, starting at your head to your shoulders, but you're going to make sure not to bend your hips. I'm going to hold is it okay if I hold my hands here?
Mm-hmm.
Alright, go ahead and try that out for me. Let's go slow. Slow, slow, slow. Alright, stop. Make sure to breathe. Alright, good job. I got 54. Relax for me. Alright, the next thing we're going to do is extension, so it's kind of the same thing, but you're going to go backwards. I'm going to be holding onto your hips, okay? Try not to bend your neck as much.
Okay.
Alright, go ahead and go backwards. Stop for me. There you go. You comfortable? You okay?
Mm-hmm.
Make sure to breathe. There you go. Make sure we're breathing. Alright, I got about 44. Alrighty, so the next thing we're going to do is we're going to do side bending. Is it okay if you lift this pant leg up for me?
Yeah, that's fine.
Scoot back a little so we're in frame. Alright. Alright, so go ahead and rest your hand to your side. Is it okay if I make a mark on you?
Yeah, that's fine.
Alright. Or you just stand up straight, bud.
That's fine.
Look up, look forward. Okay. Alright, now you're gonna slide your hand down your leg as far as you can. I'm gonna hold on to your hip to make sure. Go ahead. Stop. Hold that real quick. You okay?
Mm-hmm.
Alright. The marks. Alright, got about 19 centimeters. Alright, the next thing we're going to do is, you can go ahead and sit back down for me for this one. So we're going to do TMJ depression.
Okay.
So go ahead and sit up for me. So I'm going to measure your mouth, but I'm not going to be sticking this in your mouth or anything gross. What you're going to do is just open your mouth as far as you can. And I'm measuring from the bottom of this tooth to the top of the last one. Alright, I got about 6 centimeters. Good job. Relax. And document that. Alright, so the last 2 things we're going to do is some functional tests. So last time standing up. Go ahead and stand up for me. And what you're going to do is you're going to touch your toes.
Okay.
As best as you can. So let's fake. Let's pretend you can't go all the way down, so pretend you can't go all the way down.
Okay.
Oh, okay. So I'm going to measure from the tips of his fingers to the floor, because you can't really see it. Alright, you got about 13 centimeters. Go ahead and relax. I'm going to document that, 13 centimeters from the floor. Alright, the next thing we're going to do is you see the tiles above us?
Yes.
Alright, so you're going to look back as far as you can and you're going to count the tiles.
Okay.
Count them out loud for me.
2, 3, 4.
4?
Yeah.
Alright, go ahead and sit down for me. I'm going to document 4 tiles looking back. Alright, sir, well that's it for me. You did so good. Thank you for participating with me. Are you in any pain or uncomfortable?
Not fine.
Alright, do you need a shirt or do you want a drape?
No.
Alright. Alright, well I'm going to leave you in a comfortable position. We're sitting in a chair, so I'm going to make sure the chair is locked. Here's a call light. Alright, do you have any questions for me?
No.
Alright, I'm going to go give all your data to my supervising PT. Going to document my data. Going to tell my supervising PT that you had no adverse reactions and everything went well. Alright, well you're in a safe position. I'm going to go wash my hands.
Alright.